Welcome everyone to today's webinar, Improving the Patient and Provider Experience, what healthcare organizations need to know entering the pandemic's recovery phase. On behalf of Becker's, thank you so much for joining us today. Before we begin, we'll walk through a few quick housekeeping instructions. We'll begin today's webinar with a presentation and have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is also being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you don't see your slides moving or have trouble with the audio, please try refreshing your browser. You can also submit any technical questions into the Q&A box. We're here to help. With that, I'm pleased to welcome today's presenters. Tommy Galen serves on the Executive Committee of Community Health Systems, which includes 83 affiliated acute care hospitals and more than 1,000 sites of care across 16 states. She leads strategic planning, marketing, consumer engagement, and corporate communications departments, where she's responsible for facilitating the strategic planning process and developing marketing strategies that support the organization's growth objectives. Tommy also manages reputation building initiatives, community and media relations, and serves as a company spokesperson. Previously, she led similar functions in other healthcare organizations and began her career as an award-winning broadcast journalist in markets that include Las Vegas, Phoenix, and Miami. Annie Harmon is Head of Strategy and Consulting, Healthcare and Life Sciences at Reputation, where she partners with leaders of large healthcare organizations to provide data-driven insights, maximize value, and drive patient acquisition. Annie also consults with healthcare leaders on programs to improve consumer experience and quality. Previously, she led digital marketing and online experience at Ascension, where she introduced new strategies for online consumer access to drive growth. Tommy and Annie, thank you so much for being here today. I'll now turn the floor over to you to get us started.
Thank you so much. And we're really excited to be sharing a little bit around the best practices for consumerism and managing feedback as we enter this next stage, and hopefully it is, post-pandemic as we're looking to wind down the acute crisis and move more toward ongoing consumer experience in healthcare. So we know that it's been a transformative couple of years. Healthcare is changing rapidly, and consumer focus is a priority for most organizations. And this is especially as we come out of the end stages of COVID-19. And in fact, a survey last year by Kaufman Hall found that 73% of healthcare executives believe that they are lagging behind non-healthcare industries when it comes to digital offerings that deliver on consumer experience. And only 7% have a dedicated focus and resources to build a consumer-centric infrastructure in order to deliver on a positive experience. So we know that this is a priority, but we're really struggling to deliver that right now as an industry. So before we dig too deep into this, I want to ask you all about the biggest challenges that you're facing right now. Obviously, we've got a lot of issues on our plate. We are striving to gain actionable insights from all of this data that we can collect. We really need to optimize the digital front door to drive more access to care and understand the voice of the customer. And that could be our employees, it could be our patients, it could be other stakeholders. And on top of all of that, we are dealing with unprecedented levels of staff burnout and attrition. So feedback and experience management becomes really critical. And I'm not surprised to see that last one is as high as it is. I don't know anyone who I've spoken to recently who isn't facing this challenge right now. And so as we think through some of the themes for today, there are plenty of ways where we can use employee feedback, candidate feedback, patient feedback to drive better experience for your staff. So moving on to the key trends that we're going to be covering today. So we do an annual healthcare consumer survey. We partner with YouGov, a third party, to survey over 1,000 healthcare consumers every year. And then we also combine that with some analysis using our data science team to look at the 25 largest healthcare systems, all of their acute care locations, and more than 300,000 providers nationwide. We look at what consumers are saying about their experiences to look at trends. And what we are seeing coming out of these most recent reports are that the feedback economy is becoming a critical part of healthcare, just like it is in every other industry. Google continues to co-opt the patient journey, and we'll talk a little bit about that today as well. And, as we look at feedback that is out there, what are people saying about the healthcare experience? It's really important to start collecting feedback from multiple sources, and traditional feedback collection methods haven't really hit on this yet. So we're going to do another quick poll here. As we talk about consumer experience, we know that this is a changing aspect of healthcare, and overall, the entire organization is responsible for CX. But within your organization, is there a team that is ultimately leading the charge here? Is it the digital group, marketing, patient experience? Is it the strategy team, or do you have a CX function that has been built up within your organization already? I'll give it just a moment here to collect some additional responses here. All right, so this is, again, not surprising. I am surprised that there aren't more people who mention a strategy and CX function having been created. It could be that you already have those functions, but that CX is ultimately the owners of that. So this is really good for us to see as we think about who the audience is for the information we're sharing today, as well as who would benefit from this information. So now we're going to get into the nitty-gritty. What are our tips? What are some things that you can do today to start optimizing the consumer experience? And as I mentioned, our data science team analyzed nearly 3 million patient reviews nationally across almost 200,000 physicians and locations, as well as nearly 100,000 facilities and locations in the U.S. Then they analyzed all of these reviews. They also looked at more than 1 million online reviews by employees in healthcare across, healthcare-related and employment-related review sites, and compared that to sentiment within healthcare as well as across other industries. And so I'll just say that we're not going to get into the entire report today, but if you go to our website and go into the resources section or in the healthcare section, you'll see that. We'll also be sharing it at the end of this presentation. So we all know that ratings and reviews have changed the way we behave as consumers. We look at feedback to make decisions about the shoes that we want to buy on Amazon, or a hotel to book on our next trip. And this feedback is now a critical aspect of the healthcare selection process. And I want you to consider something that our report found. The top 3 factors for a consumer when selecting a physician are, number 1, insurance, number 2, location, and number 3, online ratings and reviews. Now, this was the second year in a row that reviews outranked brand as a factor. And this is really important because it tells us that, the same thing that most industries have already figured out, your brand is not what you say it is. It's what your customers and employees say it is. So in some healthcare organizations, we're finding that this loss of control over your own brand can be challenging to accept, and to really embrace the feedback that is happening elsewhere that your consumers are seeing. It requires a culture change from within, all the way up to leadership. And so I want to ask you, Tommy, as CHS is a leader when it comes to this stuff, what do you think is the best recommendation for getting buy-in within your organization for a feedback culture?
Yeah, Annie, I'd love to talk about that, and maybe I can tell the story of a pivotal moment that happened at CHS that really changed everything for us. And if I go back to where we began a few years ago, soliciting and responding to online reviews was a marketing program. We were spending a lot of money on advertising, but we knew that if we got a consumer's interest, that consumer was most likely to go online and check out our ratings and reviews before making a decision, and that they would trust those ratings and reviews. So we wanted to be sure that if we were going to advertise our services, our products, our physicians, our facilities, that when consumers looked at the reviews, there would be positive feedback there. And it was important for us not just to get the sentiment up, but to have timely reviews, frequent refresh of reviews from people who had just been there, because we knew that those reviews would hold higher credibility. And we also knew that if we responded to those reviews, we would be perceived as a more of a caring organization. So everything we put in place was great, but it was a marketing program. And one day, several months after we had begun the journey, and by the way, we're a large organization with 83 hospitals. So each of those hospitals, the process is that the marketing leaders in our process, in our facilities, receive the reviews, respond to the reviews, and escalate those reviews within their own hospital organizations or practice organizations so that there's visibility on those reviews. And everything was going really well. And we were hearing, this is great. Look, our ratings are going up. Wow, we've been able to do service recovery with an individual patient or a family. It was all going really, really well. But it was not generating a level of insight and overall organizational improvement that was possible at that point until the day that I escalated a particularly negative review to the CEO of our company. So not just to the hospital where it happened, but to the CEO of our company. And this was a review that was very concerning to me. There were risk management implications. It was a review I saw on a Sunday morning, and I sent it by email to our CEO, and his response was, who knows about this and what are we doing? And I said, well, presumably the hospital marketing leader received the review and escalated it to the CEO. And he said, did that happen? And within minutes, he had emailed the CEO of the hospital, the CEO's boss, who in our organization is a regional president, our chief medical officer, people in the quality department, people in the risk management department. And all of a sudden we had so many people looking at this single review and acting on it. And fortunately, at the hospital, they were already aware of it and they were already dealing with it. But when our CEO could see the power of being able to see real-time feedback and respond to it organizationally, it turned the tide. All of a sudden, everybody at CHS and across the organization was really concerned. How did the CEO see that review? When does he see the reviews? How is he seeing these reviews? They wanted to be out in front of them before our CEO. And so the next day, on a Monday, we began to create automated reports with all of our reviews that went out to large numbers of people. And everybody shared accountability around making sure we understood the feedback, positive and negative, that was coming in, and doing what we needed to with that feedback, whether it was service recovery or, in this day and age of staff burnout, recognizing and affirming and sharing positive feedback with our team. So I would say now today, instead of a marketing leader and someone in the hospital seeing a review, there are very few reviews within our organization that don't get seen by at least 10 people every day in real time, from the previous day, and we've had over 67,000 reviews this year. So you can just imagine the power of that many people listening to and responding to the feedback of our customers, and that was the game changer for us. It made a difference when our CEO said, this is really important information and we have to do something about the feedback we're receiving.
Thanks for that story, Tommy. And, you know, with all of this work that you've done, it's going to come as no surprise to those on this webinar that you are a top-ranked brand. And I just want to share a little bit about the formula that goes into our annual ranking of health systems. So it's based on a proprietary metric we call reputation score. Now, it is proprietary, but it's very transparent and easy to understand. It also provides a wide-ranging and complete analysis of structured feedback like a rating or, you know, a numerical metric like volume of reviews, and also unstructured data. So what are the comments that people are actually saying? What is the sentiment there using our natural language processing AI? So in this case, we looked at structured data elements such as how complete are the descriptions of the locations and physicians for these brands? How accurate is the data that's out there that consumers would see? What about the star ratings? Are they positive? Are they negative? What are the averages? And we found in this analysis that physicians with higher reputation scores have 219% higher conversions, and healthcare facilities with these higher scores have an 838% higher conversion rate on these Google profiles. Now, with all of that in mind, that's why we believe that reputation score is such a meaningful KPI for healthcare brands to track. And I'll go into more about this calculation in a moment, but you know, obviously we have the #1 ranked healthcare brand on among the top 25 largest right here on the call. So Tommy, can you tell us a bit about what it means to CHS to be #1 on this list?
Yeah, well, Annie, you'll remember when I first heard the news, and I think my jaw dropped, and I was thrilled, obviously, but also know that a lot of healthcare systems are doing a tremendous amount of work in this area. And for us to be about 3 years into the journey and to be at the top of this list was a real sense of accomplishment. It's wonderful. It's not why we do what we do, but it was very validating, and it really reflects on the work that's happening across the organization. And it can't belong in a small siloed group that takes care of it, but I think the secret to our success has really been how many people are aware of this work and that participate in the work. I love the bar graphs that we have here as much as I love that #1 ranking, because it really shows the difference from when we started and where we are today. And you see a lot of green, so a lot of positive feedback that we've received since soliciting reviews. And I've read the negative reviews have not gone up all that much. And in 2022, we'll see this go even further because we are now starting to solicit for outpatient procedures, which before we were only soliciting for our physician provider visits and for our inpatient visits. So we'll have even more reviews. And, you know, I know some people think, well, when you solicit that much, how much work is there to do? We've structured this in such a way that the feedback and escalation process is very simple. It doesn't take that much time. And so we are able to respond to about 90% of the reviews that come in. What makes me most proud of where we are today is that this represents a real shift in our culture where feedback matters at CHS. And it's not just the feedback that we solicit internally, so when we round on our patients or we send them HCAPs, but we're listening to the unsolicited feedback, although we do solicit for reviews, but there are also a lot of reviews that land there without our solicitation because we solicit our patients, but we hear feedback from their family members and from others who are friends about their experiences. So we get a lot of unsolicited feedback too. So the feedback matters. It's become actionable for us. We act to celebrate the good. We act to fix that which is not working. And we have an insatiable appetite for more, because we think that the more we listen to what our patients and our consumers are saying, they realize we're listening, they understand that we care what they have to say, and they begin to understand and know that we will use their input to improve. And we think that's part of what makes our brand stronger, because this is one of those ways where we really can directly interact with the people who consume our healthcare services, and also share with those who are considering our healthcare services the experiences of those who have already received them. So thank you to Reputation for the recognition, and more importantly, thank you to everybody across our organization who has worked so hard to make this possible. Hey, Annie, I'm turning it back over to you. If you're talking, you might be on mute.
I'm sorry. I was on mute. That's the theme of our virtual lives now, is getting unmuted. One thing I want to mention.
I was just going to say, if I don't tell somebody that they might be on mute at least once a day, I feel like I haven't done my job that day. So,
exactly.
It's our experience.
So before we dig into more about the leaders versus the laggards, I want to point out that what you're seeing, these top 15, these are the leaders. We actually analyzed the 25 largest healthcare systems based on revenue. And so, there are these 15 who are the leading brands, but then there were another 10 that didn't make the list. And we wanted to look at what is the biggest difference between the leaders and those that didn't make this list. And so, you mentioned, Tommy, that feedback collection via reviews is so important. And as you can see from this graphic, the biggest difference among the leading health systems we analyzed was in the volume of feedback. So they had 237% more reviews than those that didn't make the list. And this is important because you can think of the volume of feedback as the statistical significance. So Google's algorithm is very good at recognizing the factors that make certain feedback more valuable to people who are searching for care. So, for example, a brand with or a physician with a 4.5 average star rating and 100 reviews is often going to show up higher in an online search than one with a 5-star average but only 10 reviews. This algorithm is seeing that there's more statistical significance across those 100 reviews than in the one with only 10 reviews. And it's also going to favor more recent reviews. So it's really important to keep those reviews coming in. For example, sending a text after a visit that you have with a patient, and also engaging with those patients who are sharing feedback with you. So we've talked a lot about feedback. It's critical to consumers as they make a healthcare decision. We've talked about Google, but why is it that Google is so important? Well, it remains the most popular source for searching for a physician or hospital. It's more popular than your own provider or physician website. It's more popular than any healthcare specific site, more popular than social media, and it's the #1 review site used by healthcare consumers. And this has been the case for several years of our consumer survey, and the data, backs this up by the amount of traffic that's now being shifted from our clients' websites over to the Google experience. And what does that Google experience look like? Well, 81% of healthcare-related searches on Google are based on symptoms. So, for example, how to tell if a bone is broken, or symptoms of COVID versus the flu, or how long am I contagious before I should retest. You know, all of these themes are driving consumers to seek care based on what Google tells them about their symptoms. So once I search those symptoms, Google's going to give me results based on not only the keywords, but also based on my location. This is known as local search. So this isn't search that's going to be driven by the content on your website. This is search that is going to be driven based on the location of that individual, and Google is going to serve up treatments and specialists based on those symptoms. In the results, then if they click on those specialists, they're going to be taken to a list of provider locations that treat that condition. Now you'll notice you are still in the Google experience here. You don't go off to a search results page outside of Google Business. You're not going off to a WebMD page that, you know, in fact, WebMD content is being pulled in by Google. You're not going off to your own website's page here. This is why these Google Business profiles are just as important as your own website. In fact, 65% of organic search on Google results in a conversion right here in the Google experience. That means that they may never even make it to your website. So in other words, Google is intercepting patients before they would get to your site and start to search for a provider or location. And this became really evident as our clients started sharing with us that the traffic to their websites was remaining relatively stagnant, but their Google traffic was up exponentially year over year. And Tommy, you shared with me recently that when you incorporated online scheduling links into your Google profiles, you saw this in effect in real time. Can you share more about that?
Sure. For us, when we started adding links to online scheduling, and primarily this was with our physician providers, so people were scheduling appointments for a primary care visit, we put a link into our scheduling system that's available to consumers online, and they would go and click directly there and schedule an appointment, which meant that they didn't have to click to our website to find the online scheduling place or to go into that environment to get to the inventory of appointments that were available. And because if you can imagine for an individual provider, you know, if you're looking at a Google panel for Dr. Smith, then we can link you right to Dr. Smith's schedule. We invest a lot of money in search engine marketing. We have enterprise campaigns that drive to primary care online scheduling. We have medical group websites. We have hospital directory sites that have online scheduling. But the link to online scheduling for our providers from the Google Business Listings is the top performer of all sources of and avenues to get to online scheduling. So that's been true for a number of years for us, and the benefit of that is if you're managing your listings well and they're up to date, it doesn't cost a lot to add a link to a business panel and be able to go ahead and produce your schedule. This year we were part of a group of healthcare providers that partnered with Google to actually show the actual appointment time on the provider listing panel and be able to show here's when the next new patient appointment is, here's when the next sick patient appointment is, and we're seeing really good results from that as Google continues that test. And the don't speak for Google, but I would not be surprised to see them roll that out more globally as time goes out, and it bears that these options for consumers to be able to actually see the appointment times right on that business listing gives them even more control over scheduling appointments. So we take these business listings very seriously from top to bottom and understand that this is where our consumers are making decisions and acting on their decisions.
And you're absolutely right, Tommy. That is something that we are seeing among all of our large healthcare systems, that we are seeing the online scheduling rolled out right within the Google Knowledge Panel. This is similar to what we saw with health insurance, that Google wants to get that information to the consumer at the right moment in their search and get them converted as quickly and as high in the funnel as possible. So let's, we talked about these Google listings, how important they are. It's also really important because they give us some insight into both solicited and unsolicited feedback, and that's really important to understanding a complete picture. So let's talk about the third theme in our recent report, and this is especially important as we come out of the pandemic and we're facing staffing issues and we're in a crisis as far as burnout goes. Really listening to the voice of the customer, and that customer could be an employee, it could be a patient, it could be a family member, listening to those things and being able to understand it. And Tommy mentioned that, by looking at external unsolicited feedback, they're seeing insight into the experience that they wouldn't otherwise have. And, that comes from family members or others who maybe have comments about the experience but aren't going to receive a survey or a review request. So think about traditional methods of feedback like surveys. You are collecting feedback after an experience has occurred, and you're only collecting feedback from that individual with whom you solicited the feedback. And that's great, that's important, but it's only one channel of feedback. And bringing all sources of feedback into a single hub and then using an AI, natural language processing, that enables you to understand the complete voice of the customer. And why is this so important? Well, first of all, what your patients and employees are willing to say to you in your surveys is different from what they are going to say about you in reviews and on social media. And this ties again both to the patient experience. We see that on a daily basis, but we also see it in the employee experience. So for example, a client recently shared with me that they were struggling to fill several open nursing positions, and in this one particular location, it was a bigger issue than maybe in other locations they had, and they had no trouble filling the other locations with qualified candidates, but in this case, they seemed to be getting a lot of applications, but not enough qualified candidates were being set up for interviews. And so they looked into their Glassdoor and Indeed reviews for that location, and to their surprise, they found a lot of comments from applicants. So candidates who had applied and started the process, but then indicated that the recruiter had ghosted them. And it turned out the recruiter wasn't ghosting them. There was a problem with the way that the workflow had been set up. So candidates were not getting scheduled for interviews. Qualified candidates were being lost because action wasn't being taken in time. And to the candidate, the experience was, oh, they said they were interested and then I never got set up for an interview. To the recruiter, it was, we tried to set up an interview and the candidate never showed up. So in a competitive job market like we have today, the speed to action could make the difference when a candidate is looking to make a move. And had that CNO not thought to look into that external feedback, they never would have uncovered this problem. And this is just one situation. Think about all of the areas that bringing structured and unstructured sources of feedback data into a single hub would enable you to holistically understand. So I want to go through another example of this. We had a client who was looking at internal and external data, and they were looking at these in separate silos. So the marketing team was seeing all of the experience insights coming from the social media listening, from online ratings and reviews, from their NPS surveys, and the patient experience team was looking at the HCAHPS, and you had two separate sources of data. And one of my clients recently shared with me that they had a 6% response rate to these CAHPS. And as we know, HCAHPS are sent to, a subset of all of the patients. They were sending it to their acute care patients, and they were only sending it to a sample of those. So essentially, they were looking at a fraction of a fraction of a fraction of all the experiences with their brand. And this is fine if your goal is simply to meet a minimum reporting requirement. But this healthcare system realized that they could not count on a small data set to make major operational decisions and prioritize certain improvements, whether it was going to take finances or resources. They wanted to make sure that whatever they were doing was prioritized to get the biggest bang for their buck. And when we brought together their HCAHPS data plus social media comments plus online reviews, and then ran natural language processing against all of that feedback, we saw a very different picture of the overall experience. And as you can see, we saw some new themes emerge. Some other themes fell back in overall volume, and some themes remained consistent across the board. So I'm not telling you what business decisions to make. That's up to you as the leaders of your organization or your department or your team. But with a better understanding of the entire experience with multiple sources of feedback, you can see where to focus your attention, where it's needed the most in order to support your strategic objectives. And what I love about doing this is that we're able to create a more statistically significant data set to draw conclusions from. So use that data to make better decisions about where to invest time and resources for the biggest impact, because it was true before the pandemic and it's true now. We can't do everything. There's no way we'll get it done. And consumers expect to have a good experience. So where can we invest our time and resources to make that big impact for them? Now, Tommy, we've covered a lot today. And for those who are eager to get, some nuggets or the most important key takeaways, what is it that you are going to recommend as far as taking action after this webinar?
Well, definitely start with listening. You cannot listen hard enough, long enough, often enough to what your patients and their families and consumers and members of your community are saying about the experience that you provide. So as I mentioned earlier, we do that so intentionally when we round on patients in hospitals, when we send discharge surveys, we solicit that feedback, but we don't always listen to it when it's unsolicited. So we have to listen to it internally. We have to look at the external places where feedback is provided, and we have to really understand, I think, what are our consumers saying about us. So listening is a constant, never-ending process, and it is the first step to being able to affect positive change. You've got to listen. You've got to know what's being said about you. Then the second thing I would say is For online feedback in particular, we need to respond, and we need to do that as close to real time as we can. So today's patients expect the same kind of customer service they can get from every other industry. And, you know, we're putting chatbots on our website so we can give immediate answers and immediate responsiveness and immediate satisfaction to consumers when they have a question about our services. We respond on social. We need to be looking at third-party ratings and reviews and be responsive to those so that our customers know that they have been heard. Also, we know that these review responses can be helpful from a marketing standpoint in ensuring higher rankings, and definitely because we know consumers trust what they read in these ratings and these rankings, and so they not only read the reviews that are left for you, but they read the way you respond to those reviews. So those responses are incredibly important, should be authentic, and should be empathetic, and definitely should look to close the loop when a patient has had a bad experience or a family member has had a bad experience. And again, the power of these reviews when we're recognizing our teams for what they do well can't be overstated or underestimated. We love to share the positive comments, and our teams love to hear them. And then finally, you know, really think about it not just as where we started and where I started my comments earlier today as a marketing program, because I'm in marketing, or a patient experience program. If you're in patient experience, it's really about creating a culture where feedback is important, where that data is shared widely and broadly, and where you use it to make improvements and to make changes that create an even better experience for people who are using your healthcare services. And for any and every one of us who has ever had to use a healthcare experience, we know that it's not always a pleasant experience. It's not always an easy experience. And so it is so important as providers of healthcare that we use that feedback to figure out and to constantly work towards how can we do it even better. Getting buy-in from your leaders for those reasons is not hard to do. You might have to have a pivotal experience like I did and have one review that really catches a CEO's attention, or maybe it's just a steady drumbeat of highlighting why all this feedback is so important to an organization. But, you know, it's just, we all want to be heard. We all want to be seen. We all want to feel like people understand us. And this is a great opportunity for us to do that with our patients. So those would be my takeaways, Annie. And I know others probably have others, but when I think about why we do what we do, that's what I think about.
Tommy, thank you so much. And we do have several questions that have come through in the Q&A, but before I bring those up, I wanted to make a note here that if you have other questions, you know, feel free to reach out to us. You can reach us directly via email. My team accesses the healthcare strategy email. We've also got a healthcare section on our website where you can get more of these reports as well. Okay, so I'm going to start with a question that I think can be pretty quickly and easily answered, and I'm going to take that one because it's easy. And then Tommy, I'm giving you the hard one, so get ready. There's a question. Do you have any thoughts about how the end of the public health emergency will impact telehealth? Now, I'm going to come at this from the aspect of consumer experience rather than from the provider point of view on healthcare access. And what we are seeing among our clients is that they are pushing more into virtual care as a channel for care, as part of their digital front door, and they're doing this based on feedback that they're getting from patients who have now tried it and liked it. You know, the biggest problem with virtual care leading up to the pandemic was two things. It was, number one, patients didn't really get it. It wasn't really understood. And number two, there wasn't a big, reason for healthcare systems to make them get it, because it was sort of a loss leader. You know, we hoped that they would stick with us for follow-up care, but, you know, they'd have that experience and largely, that was it. And now, as the pandemic has taught us all what a Zoom is and when to get off mute and that you can have a real interaction virtually, a lot of that care is shifting. We see it in mental health. We see it a lot in more of the low acuity services. And so that is only going to become more and more at the forefront. And it's really important that as you're looking at your access points for care, your digital front doors, for example, that Google journey that we went through, that you are including virtual care options there, answering questions about virtual care, and also that, as with an in-person experience, you are requesting feedback after a virtual visit. The biggest thing I saw as the moment that we had to catch up when all of this scaled after we shifted to telehealth was that a lot of our healthcare clients were coming to us saying, okay, we scaled this thing, we went live with our telehealth solution, and now we have no idea if patients are having a good experience or not because we forgot to incorporate feedback mechanisms into that. And so, doing a review request, doing a quick feedback survey at the end, that is going to be really important. And most of our clients are now doing that, pulling it in as an additional source of feedback to measure. So, Tommy, this one has to do with more of the politics and culture change, which I think is the more difficult part. So to what extent have you done education with your providers about online reviews? So for example, what you can and cannot do, like if a provider doesn't like a review, you may or may not be able to get that removed if it doesn't violate the terms of service. So what are you doing internally to manage expectations with your providers for how to respond to that?
Yeah, this is a tough situation at times, but really has not been a huge challenge for us overall. And here are some of the reasons. We did a lot of front-end education about why it was important for us to solicit reviews from their patients, how we were going to respond to these reviews, how we were going to be sure that providers were informed about the reviews, and what we can and can't flag as an inappropriate review on Google in particular. And, as you all know, that an inappropriate review is different than a review that you just don't like. The good news for our providers is once we started soliciting reviews, all of their ratings hover. I don't think we have a provider below around 4.6, 4.7, but more often we have 4.8, 4.9, and 5.0s. And probably more like 4.8 and 4.9 because it's almost impossible not to, from time to time, have a negative review. And often, those are not even about the provider, but maybe the office staff. So when we do run into occasions where a provider has a review that they are particularly unhappy about, we generally will communicate with the provider about what can and cannot be done in terms of flagging to potentially remove the review. More importantly, we talk about what responses can be offered. We do have some, restraints and constraints in that even if a patient posts about an experience, we still have HIPAA to consider and have to protect PHI and cannot elaborate in detail around the experience that patient had. When possible, we try to do outreach directly to the patient, pick up the phone and make a call and see if we can do service recovery. There are times when we just cannot overcome disappointment or the frustration of a patient. And what we have been able to effectively achieve is through continuous review solicitation. Negative reviews generally drop lower on the screen, and we are able to, get so many positive reviews that they outweigh a negative review, and the providers are generally pretty happy when they can see that. So multi-pronged, definitely a lot of education on the front end, collaboration with the providers in real time, and most importantly, every effort we can to work with our patients when they have had a bad experience. We've seen a number of patients update their reviews and say, well, they called me, here's what they did for me, and now I'm going to, take this 2-star rating and make it a 4. So I hope that answers your question. That's some of the ways that we have approached working with our providers.
Thanks, Tommy. So this is one of my favorite questions, and it was when I was on the provider side as well, because I worked for a mission-driven organization, and we wanted to reach the patient populations that needed our care the most. And this question is, how are the opinions of low socioeconomic patient populations reflected when those patients frequently lack the technology to participate in digital feedback and normally are a source of lower quality health care? So 2 things that I think are really important here. One is that there are ways to collect feedback that require nothing more than a cell phone. SMS text has become, an affordable commodity, whether it's a pay-as-you-go phone or an all-inclusive plan. There is no socioeconomic group, and I'm basing all of this on Pew data. So if you go to pewresearch.org, you can find some of these stats, but there is no socioeconomic group that has lower than a 97% of them owning a smartphone. So, when you look at the data, and this goes for those who have, less than a high school education, it goes for all ethnic demographics, white, Black, Hispanic, urban, suburban, rural, and all ages too. The area where I think, so if you focus on mobile methods of collection, our traditional methods, like sending someone an email or sending a paper survey through the mail, that was, reliant upon a permanent address, which doesn't really work if you've got a population that is, not at a permanent residence. That doesn't really work if you've got someone who isn't checking email regularly or doesn't have a reason to check their email regularly. But most of them, and again, I'm not solving for every single case here, but most of them do have a phone. And so making sure that your, number one, your CRMs and your EMRs are set up to solicit feedback through SMS texting or, through other methods. Collect all of that and make sure that those numbers are regularly updated every time you see a patient. And then combine that with also feedback collection at the bedside, feedback collection in the urgent care, in the ER. We've got clients that set up different scannable QR codes to request feedback from patients, and maybe that goes to a survey, maybe it goes to a review request. But there are many, many ways of getting in front of those populations that have traditionally been difficult to reach because they are, of varying socioeconomic status. But what we are seeing is that third-party feedback, the feedback that comes in the form of a Google review, for example, knows no socioeconomic bounds. We're seeing it across the board with all types of patients. And so that's what I would recommend there. And the only other point I'll make on that is that there are other opportunities to collect feedback from audiences that maybe have some sort of limited capability to use a mobile device. If you have limited dexterity, if you are, elderly and have trouble using a technical device of some sort, we're seeing that a lot of the bedside feedback collection is enabled through digital means, and also asking for feedback from family members. The adult daughter is typically making those decisions about care for her parents and for her children. That's well known that she is kind of that sandwich generation right now. So getting that person's feedback on the experience that the person who may not have access to that technology, that can also solve for that. But if you'd like more ideas for how to reach those different populations, we could certainly talk. We probably have time for one more question here, and I'm going to have Tommy wrap it up here. When you rolled this out internally, how did you get internal stakeholders engaged across service recovery? They're concerned that the volume of new feedback coming in is going to prevent them from being able to take action in real time across the board.
Well, take comfort in knowing that when we started soliciting reviews, our positive reviews increased exponentially and our negative reviews remained pretty flat. It was wonderful because what happens so often is that people who have a negative experience are going to talk about it anyway, and people who have a positive experience really aren't unless you ask them, and then they're happy to tell you about it. So the number of times that service recovery had to be implemented as a result of our review solicitation didn't really grow from what it should have already been. It became extremely manageable. It's a CEO of the company, CEO of the hospital, practice leader of our practice mandate that we are going to do the best we can for our patients and respond when they've had a less than wonderful experience. It has not been a burdensome task, and it has yielded some really great results. So hopefully that gives a little bit of comfort.
Well, I want to thank you, Tommy, for all of the work that you are doing in your communities to deliver an amazing experience and easier access to care for those that you're serving. And I also want to thank everybody who is working in healthcare today. That is the majority of the audience on this webinar. Whether you're touching patients directly in a clinical way or doing something as a support function, we really appreciate the work that you're doing in all of your communities, and we're privileged to do the work that we do in healthcare. So thank you very much for your continued work on the front lines and to make care better for everybody.
Very, very well said, Annie, and thank you so much from all of us here at Becker's. Again, a fantastic presentation from Tommy and Annie, and some really great questions from the audience in there as well. So please, to learn more about the content presented today, check out the resources section on the webinar console and fill out the post-webinar survey. Thank you so much for joining us today. We hope you have a wonderful afternoon.